because we're talking about the more extreme cases, I'm going to turn to the big hot ticket, which is dexamethasone. Dr. Jerry, tell me, is this a game changer?
You're asking me loaded questions today. We hope so. To be completely honest, we hope so as a medical community, because we've been desperate to find something that works. There's been different medications along the way that we've used. The dexamethasone, we are optimistic about. In reading the press release, the problem is it's a press release. It was 6,000 patients. 2,000 of them got dexamethasone and did better per the press release. As a medical community, we would like to see the actual manuscript because we would like to see if it was good science. I am convinced it will be. It was done out of Oxford. They had a lot of patients. They have their protocol out, but you want to make sure it's good science. So do I believe in dexamethasone? Potentially, yes. It's a low dose, and if it could potentially improve outcomes, then yes. But then it's within a certain subpopulation of people. So as Dr. Nick was saying, most people don't become very ill, and most people don't need to be in the hospital. It's the very critically ill people, the people who are needing high amounts of oxygen, in which it potentially reduces mortality. So the people that end up seeing me in the ICU, for instance, that's the potential people who are going to benefit from this. So it's not a for everyone drug, unfortunately, but it may make things better for people who end up being the sickest.
Commenting on how oncologists use dexamethasone as well, is there a scramble for this drug that we foresee for any sector of medicine that might feel that they should have first dibs at it? Should it prove the magic cure?
That is a great question and a scary question. And I would agree with Dr. Yakaba. There are instances where dexamethasone is used, and it's a great medication, especially for people who have cancer. It shrinks sometimes the tumor while they're getting chemo in. So it's an important drug, and we fear shortages long-term, because as people scramble and people are scrambling, we may see shortages, just like we saw with hydroxychloroquine at some point. So I think that's why it's important to emphasize that it's going to be a small population of people that it actually helps, and those are the sickest of the sick people who have COVID. But that being said, unfortunately, there's going to be a scramble for the medication. It is cheap. It's manufactured internationally, so potentially will be more available than something like hydroxychloroquine, which is a little bit more specialized. So hopefully we won't run out of supplies for it, but there will be a scramble, and we need to emphasize that it is, from what we're seeing from the data or what was released of the data, it only works in a subset of people.
So what of the school of thought that says there is a good alternative? But what would you say to people who are kind of looking for what they believe are viable alternatives and self-diagnosing or self-medicating?
I would definitely caution people about that, especially if it's actual medications. So for instance, for the flu, people have their own remedies. Some people will do, lemon and honey, whatever it is. There's things that make you feel better, and they help with the symptoms. And I think it's important for us as a medical community to say, that's fine. Drink your tea, your chamomile tea, whatever it is, that's important. But then self-medicating with some other alternative drugs as an individual, I would recommend against. Dexamethasone is a steroid medication. There are other steroids that work similarly. Now, from what I've read, and this is going to be one of the questions that everyone is asking, is, are the other steroids going to work just as well? They did dexamethasone 6, which is a relatively low to medium dose. Dexamethasone is a very potent steroid, but that's a lower dose of that steroid. I don't know, and I don't know if anyone does know, if the other steroids will work as well, but there are other corticosteroids that have similar functions that could potentially work. And that would be the goal and the hope, potentially.
So for a non-medical person, can either of you maybe talk me through what the steroid actually does physically to reduce the symptoms, to help cure COVID?
Yeah, so COVID in itself is a virus like the flu. So it will affect you, it will infect your cells, it will enter your cells. And the front end of the illness is just like the flu, where it's entering into your cells. What your body does, and I'm speaking now from a lung perspective, I'm a lung doctor, is typically once you've been affected by COVID, your body goes to fight that infection. So you have a heightened inflammation, and inflammation is your body just trying to fight that infection very hard. And sometimes what will happen is your body overreacts to the actual infection, and you become more sick because of your body's overreaction, this heightened inflammatory response. So what steroids do is they will reduce that inflammatory response. They actually reduce your immune system to a certain extent, and they will reduce that level of inflammation that you have. So the body's overreaction potentially will be reduced somewhat. And that's part of the theory behind how steroids work, is reducing the inflammation in your body's overreaction.
But if it's suppressing that, aren't you then susceptible to other viruses or other illnesses because your immunity is kind of being snipped?
That is why there's a debate and people want to see the data. With other coronaviruses before, when people were given steroids, some of them got other infections and potentially did worse. They got other infections and or did worse from the actual virus. So that's why people want to see the data. That's a very astute question, and that's a question that everyone is asking. Hopefully with a lower dose, it doesn't depress your immunity as much, but I'm now out of data and I am conjecturing. I'm not supporting what I'm saying with data, so I would love data first.